The following program was recorded live. This recording is protected by copyright law. Unauthorized duplication or distribution is prohibited.
So what was your least favorite class in high school? Math. Well, I'm your algebra teacher today. Yeah, exactly. I can't repeat that for the tape. The reason I'm your algebra teacher is that this is about numbers. So how many hospital beds certified by CMS, that's your federal government, or accredited by JCAHO are there in the United States? A lot. 955,768 as of last year. Now, at the peak of cold and flu season, according to the American Hospital Association, what percentage of those are occupied nationwide? That's actually pretty good. He did the math for me, too. 96%. That means you have a 4% surge capacity. What percentage capacity is the Health and Human Services pandemic flu plan based on? Not quite that bad. 20%. The next one is that bad. They say that 20% of your beds will be empty at all times. That means you're never at 100% in your hospital. Yeah, I'm hearing the laughter already. HRSA, the guys who paid for this course, the guys who pay for research, the guys who are paying for all of the decon equipment and training at all of your hospitals, if you wish to continue to receive that money, says that you will have 500 beds per million population served. There's 300 million of us in the United States as of October 1 of this year. That means that you are expected to have 150,000 empty hospital beds at all times nationwide. 20% would have been 160,000 hospital beds nationwide. But we only have 36,000. We're just a little bit short. How many ventilators are there in the United States, excluding the ones on your ALS rigs? According to Michael Osterholm in the New England Journal of Medicine in 2004, there's 105,000 ventilators in the United States. What percentage of those are out of service for cleaning or just plain busted? I heard 20, I heard 25, 18% according to New England Journal of Medicine. What percentage of that 105,000 are in chronic ventilator care use, not available to you in the inpatient hospital setting? 75? 60? Half? 67%. Which means 85% of the ventilators in the United States are not available to you for acute care, between the ones that are busted and the ones that are in chronic care use. That leaves you 16,365 ventilators for peak use. Now, a suggestion has been take every ventilator off of the ALS units like they'd get them out of your cold, dead fingers. Turn every ALS unit into a BLS unit and put those ventilators into hospital use. That'll get us all the way back up to about 65,000 ventilators available. And of course, you guys know transport vents can only be used for 6 hours at a time before they do lung damage. Why are those numbers important? We said there are 300 million population in the United States. If we look at the major pandemics that are used for research purposes, so we'll talk about 1918. What percentage of the world population, 100% of everybody was exposed within 12 weeks, what percentage of those people came ill to some degree? Depends on your age, 50% for one group, but 1/3 overall. That means 100 million people in the United States will fall ill within 12 weeks. What percentage of those people would qualify for hospitalization? Ended up in an infirmary back in 1918. Half. Exactly correct, half. That's 50 million people. What percentage of those developed ARDS, acute respiratory distress syndrome, would in modern day require intubation by standard of care? Very good, half. That's 25 million intubations in 12 weeks. Again, 16,300 and some ventilators. By the way, we don't make 25 million ET tubes in the United States in a year. We don't even have the capacity to make that many in a year. What percentage of the ARDS patients died in 1918? Half. They're getting the idea. The numbers are simple. Exactly correct. Half. 12.5 million people expected to die, 1 million people a week, during the largest wave of the pandemic. The problem is you don't know which half, so you don't know which half to intubate. Interesting problem. Now the CDC, you're all looking at me with those very suspicious faces, because you're saying, well, wait, the CDC told me 8% hospital and 4% were going to die. Okay, that's because you're used to thinking in terms of the flu. It's not 8% of those who get the flu. It's 8% of everybody. So if you start with 33% of the population gets sick, half of those, 16%, qualify for hospitalization, but the assumption is you're only going to hospitalize those with the ARDS. Half of 16 is 8. There you go. Half of those are going to die. Half of 8 is 4. That's where they get the numbers that they teach you. So you have to know 8%.